After proper screening and taking a thorough history, and after collecting one's information for one sleep study, the physician should have enough information to make an informed decision on the treatment of your obstructive sleep apnea. One question that I intend to answer is, what are the available treatments? First, we have the CPAP, which stands for Continuous Positive Airway Pressure. This is the first line treatment for most cases of obstructive sleep apnea. Should your patient accept CPAP treatment, it is necessary to help the patient on understanding how to use the equipment and encourage compliance with the regimen that is most appropriate for the patient. There are lots of benefits to CPAP for patients with mild obstructive sleep apnea to severe cases. It is reported to improve daytime sleepiness, and patients also report improvement in their quality of life. And it is also reported to lower blood pressure in hypertensive patients. However, there are problems that may occur with CPAP usage. There might be something wrong with the equipment, such as improper mask fitting, or the humidifier may not be working properly. Other problems that can affect CPAP may be as simple as nasal congestion. Next, we have behavioral treatment, which is a series of actions the patient can choose to undergo in order to hopefully bring about resolution of their symptoms. Weight loss and exercise are components of behavioral treatment. This is usually recommended for individuals who have a BMI of greater than 25. Although weight loss can improve symptoms in obstructive sleep apnea, it should be combined with a primary treatment for obstructive sleep apnea, CPAP therapy. Another behavioral treatment is sleep position. Sleep position has the potential to affect the size of the airway, and when laying down, it can decrease the upper airway size. It is recommended that correcting obstructive sleep apnea through the usage of positional therapy should be properly recorded with a polysomnogram. Most patients tend to use a device that aids in the positioning. These include, but are not limited to, pillows, backpacks, and belts. Other behavioral treatments include avoiding the usage of alcohol and sedatives before bedtime. Then we have oral appliances. These are devices that help open up the upper airway and help decrease the risk of upper airway collapse. One such device is a mandibular advancement device, which is essentially a mandibular repositioner. This device covers the upper and lower teeth, which enables it to hold the mandible in a jutted forward position, which opens the airway, thus alleviating obstructive sleep apnea. These devices are great for people who fail CPAP or fail behavioral therapy. Lastly, we have surgical treatment. Although invasive, these can vary from upper airway reconstruction to a bypass procedure. Of note, this type of treatment is less common than the previous aforementioned treatments, as there is limited success rates with surgery, and it requires post-surgical follow-up, which will vary in frequency depending on the type of surgery that is performed. This should be a secondary treatment for obstructive sleep apnea when CPAP therapy is insufficient. I hope this clarified the options and types of treatment for obstructive sleep apnea. Thank you for watching this video.